Okay, good morning, everybody. I just want to say thank you so much for joining us. We really appreciate your time. My name is Sarah Waldrop, and I'm the Southeast Regional Coordinator for the Mental Health Association of East Tennessee. And today we're going to be talking about a lot of really great, really important topics right now. But before we begin, I would just like to make sure that you know that if you have any questions at all during this process, please feel free to drop those in the chat box, and I will be keeping an eye on those. We will have some time at the end of our webinar, hopefully to answer as many as we can, but rest assured, if we don't get to those questions at the end, I am going to be collecting them and we'll be sending out an email at the conclusion of the webinar to everyone that has the answers to those questions. And so whenever we look at the Mental Health Association of East Tennessee, we are dedicated to the promotion of mental health awareness, wellness, as well as the recovery in our communities. Our programs are spread throughout the East, Northeast, and the Southeast regions of the state. And we provide programs that educate and provide resources towards early intervention, recovery, and advocacy. So to start off the presentation, I would like to go ahead and pass this along to our Northeast Regional Coordinator, Emily Wells.
Thank you, Sarah. So I'm going to just go over an outline of what we'll be covering today. So for starters, we're going to do a presentation that discusses the mental health statistics specifically for school-aged youth here in the state of Tennessee. We're going to be discussing some sources of trauma and stress, specifically the effects that COVID has had on our student population. And then we'll talk about warning signs that you can look out for in your students or in youth in your life. Then I'll pass it back to Sarah, who will be moderating our panel interview. We have some mental health experts on the line that are going to talk to us about how to respond if we do notice these warning signs. And then we're going to wrap up with some resources that you can access and use after this presentation is over. So to start off, I want to go over some statistics with you all to help us better understand mental health for Tennessee students. So the Youth Risk Behavior Survey, in case you are not aware of it, it's a national survey that monitors health-related behaviors that contribute to leading causes of death and disability among youth. And it's conducted at state and local education levels to help give us a better picture of the issues we may be dealing with. So the most recent data set we have available for Tennessee is from 2019. And based on these percentages we have here on this slide, and assuming the average class size in a high school in Tennessee is 30 students, for a classroom in the past year, 10 to 11 students met the clinical symptoms for depression and other mental health conditions. 5 to 6 students contemplated suicide, 4 to 5 students planned suicide, and 3 to 4 students attempted suicide. So these numbers show us how incredibly serious and common mental health issues are in high school students here in Tennessee. But mental health issues are not something you will just see at high school level. Mental health conditions affect children of all ages, and early intervention is extremely important, especially considering that half of all lifetime cases of mental illness begin by age 14, and 75% will develop by age 24. So as we can see here, the average age of onset varies based on type of diagnosis. So beginning with anxiety disorders, the average age students will begin experiencing symptoms is age 6 years old. And anxiety is the most commonly diagnosed mental illness for children and adolescents. Behavior disorders include ADHD, oppositional defiant disorder, and conduct disorder, and those begin at 11 years old on average. Mood disorders include major depressive disorder and bipolar disorder, and those begin at 13 years old on average. So prevalence definitely increases as a child gets older, but mental health is an issue that needs our attention at every grade level and at all ages. So teachers and other adults can make a huge difference, especially when they create mental health friendly spaces and intervene during times of struggle. So we're going to take some time to talk about trauma and stress. So mental health conditions likely have a genetic component, but they're also sometimes a direct response to what's happening in a student's life. So traumatic events can trigger problems such as depression or anxiety, especially for those that are already vulnerable. Trauma can include events like divorce, abuse, or even the current pandemic. And trauma also increases the chance that a student engages in self-harm or develops other behaviors that are disruptive or addictive. This trauma, in addition to other sources of stress, can become persistent and toxic. So when someone experiences persistent stress, it can damage the brain. This damage is especially troubling in childhood, which is a critical time for brain development. So although the brain is very plastic in childhood, these disruptions to development caused by persistent stress and poor mental health can lay a very rocky and unstable foundation for the child to grow on, which can lead to lifelong issues. So in order to be aware of common sources of stress and trauma for young people, we're going to discuss a few examples. So when we think of sources of stress, they can be broken down into three main areas: home life, school life, and social life. And we'll see how all of these areas play a role in influencing the other. So students may have stressful situations at home, including divorce or difficult relationships with family members, such as their parents. Some of our students live in homes where they experience neglect or abuse, and others may be in homes where their parents or caregivers are unemployed or struggling financially, which could lead to the student not having their basic needs met, such as missing meals or not having running water, or even having their electricity cut off. And this may be a more serious issue as we move into fall and winter and electric providers resume disconnections. So many parents are still without work from this pandemic, or if they do have jobs, they may continue to struggle to pay their bills. So looking at school life, this can also be a major source of stress. So school is where young people spend a large amount of time, and students may struggle to learn or to make the grades that they would like to, which can lead to low self-esteem. And persistent stress can put a massive strain on academic performance, as well as on the student's ability to learn. They may lack a support system at home, which encourages and prioritizes their learning, which just leads to further stress. And then lastly, if we consider social life of our student, this also plays a huge role in either supporting or harming a young person's mental health. So they could have a great supportive friendship that offers them a safe space to talk, helps decrease the negative impacts of stress in their lives, and could serve as a positive influence. But on the other hand, social life can also be a major source of stress. So if a young person struggles to make friends or to find a group of people that they feel like they can relate to, or if someone is the victim of bullying. So young people could also be negatively influenced by friends to take part in activities that are risky or harmful. So we can see how all three of these areas of sources of stress can influence the other. So a stressor that's currently present for all of us in our lives and for our students and young people in our lives is the coronavirus pandemic. So environmental chaos has a huge impact on a child's mental health. Routine is extremely important for all of us, and unfortunately, chaos has been the defining characteristic of this pandemic. School typically can be a great source of stability and routine for students. School provides a place for social interaction, reliable and consistent source of food, and education. So this stability is especially important for our students that come from unstable home environments. The return to school looked much different this year, so whether they returned fully online or they're in a hybrid model. And some students, even in the unchanged environment, are happy to return to school, while other students may be sad to return to school because they might have really enjoyed having so much extra time at home with their families. So I think when we acknowledge that all reactions to COVID are valid, it's important to point out that some students may have enjoyed their time during quarantine and having more time at home. So what we also know is that the school isn't quite the source of stability that it once was, and students don't know what to expect on a day-to-day basis. So even now, there are times when students might be in school one day, and then the next day they are home without really any prior notice. And it could be due to potential exposure or just a lack of teaching staff in the school. Students may also be fearful of getting sick or of a family member getting sick. So the last 6 months have been very exhausting for parents. They're balancing possible fears of their children getting sick versus being able to have a semi-normal routine. And there are also some parents who are stretched thin. Some might be classified as essential workers and may not be able to give the needed attention to their children. And lastly, some of your students may have lost loved ones from this pandemic. So all of this means that each of your students is going to be at a different place right now, one that has been disrupted across the board. And currently, this is causing a wide range of effects on their mental health. School provides structure and routine, a sense of normalcy, and predictability that allows for focus. So as students return to school, we need to try to get them back into a stable routine, and we need to be supportive adults who can look for signs of trauma, abuse, and help those in need. And since many of our young people have spent 6 months or more outside of school, and many might only be attending school virtually or going in person for a limited number of days a week, feelings of loneliness and isolation are becoming more common and having a large impact on the mental health of young people. Mental Health America has an online screening program that offers screenings for a wide variety of mental illnesses and mental health struggles. So between the months of May and July of this year, 2020, 70% of young people who took a screening mentioned loneliness and isolation as main things contributing to their mental health struggles. And we know that chronic loneliness can lead to poor sleep, high blood pressure, greater risk of suicidal ideation, and even alcohol and drug use. Since March 2020, of people 11 to 17 years old who took an MHA screening, 83% screened positive or at risk for anxiety, and 91% screened positive or at risk for depression. So it's extremely important for us to acknowledge that this is an issue and to keep in mind that young people are continually disproportionately affected by mental health issues directly related to this pandemic. And then grief and fear. These are two common emotions that we should expect students to have as they resume school activities this year. And grief is an emotion that we feel in reaction to a loss. And I think it's important to point out that this could be a loss that we might typically think of when we think of grief. It could be the loss of a loved one or a person in their lives. But grief can also be felt due to loss of control, loss of your typical schedule, loss of your sense of safety. And so as we all shift to what our new normal is going to look like, it's common to miss how things were before the pandemic began. And young people can have feelings of grief in response to missing out on things they used to enjoy or might have been looking forward to. So it could be things like graduation, loss of abilities to go to sports games or school dances or activities with friends. And then fear is another emotion that is common in response to the pandemic. So young people may feel fear due to loss of their sense of safety, fear of getting sick, or fear of losing a loved one. So it's important for us as adults to help young people take the steps that they can to reduce their level of fear and to process their feelings of grief. So now that we have more knowledge and understanding of the sources of stress and trauma that young people may be facing, we're going to spend a few minutes discussing warning signs. And this is going to talk about both physical and behavioral or emotional warning signs that you can pay attention to and notice in order to intervene and to try to help that student get the help that they need. So beginning with physical warning signs. These are some examples of things that you can be on the lookout for that are an indication of a young person is struggling more than issues associated with typical development. So in our students, you want to be on the lookout for behaviors that are persistent. And these can be these physical symptoms listed here. So it could be decrease in appetite or other changes in eating, headaches, sleep disturbances or nightmares, new or recurrent bedwetting, upset stomach or vague stomach pain, and then physical symptoms without any physical illness. And then they can also be emotional or behavioral symptoms, such as loss of interest or detachment. You might notice a lot of anxiety or worry, not being able to relax, new or recurrent fears, shutting down or withdrawal is a big one. A lot of people might be able to notice withdrawal from their social groups or withdrawal from class or shutting down during class, anger, crying or whining, aggressive or stubborn behavior, going back to behaviors present at a younger age. So if this is a young person or a student you've known for several years, you might be able to observe this. Avoidance of activities or avoidance of people, persistent crying or frequent crying and persistent sadness, feelings of hopelessness or worthlessness, and that's something that a student or a young person might verbally express. Difficulty concentrating, panic attacks. Some students may turn to drug or alcohol use. And then self-harm. I do want to pause for a moment and talk about self-harm. So the average age of onset is 12 years old, but it has been observed in children as young as 6 and 7. And self-harm can include what we typically think of, like cutting, but it could also include scratching, burning or branding, punching themselves or other objects, or even pulling their hair. And what's important to note is that self-harm is an intentional physical harm to the body. And anyone suffering from self-harm needs professional help. So if this is something that you notice in a student, you immediately need to help connect them with help. So knowing all these warning signs, the most important indicator of troubling behavior is if you notice them persisting for 2 weeks or longer. So if behaviors are extreme and you have noticed them for 2 weeks or longer, then it's time to talk to the student and let them know your concern and care for them. And there are some behaviors or warning signs that you do not want to wait until 2 weeks to intervene. So those would include, like we just discussed, self-harm, and they would also include suicidal ideation or homicidal ideation. So in order to know what actions we should take and what resources are available to young people and students in our lives, we are now going to move on to our panel interview with our mental health experts. So I'm going to pass it back over to Sarah.
Okay, great. Thank you so much, Emily, for all that information. I'm going to do a brief interview of the panelists that we have today, and then we'll move straight into the questions for them. First, we have Lisa, who has worked as a school counselor for over 20 years in multiple middle school settings. We have Caitlin, who coordinates the Mental Health 101 Youth Education Program since 2014. And this program has taught over 30,000 students in Tennessee each year. We have Kiki, who has worked in school-based mental health services at various grade levels and currently supervises Helen Ross McNabb team in middle and high schools in Knox County. And lastly, we have Nicole, who is the program coordinator of the school-based behavioral health liaison program through Frontier Health and has worked as a therapist within Washington County schools for 7 years. And so what we will do now is I'm going to get right into the questions. And so panelists, everyone can go off mute if you would like, and we can just take turns answering. So the first question that I would love for us to discuss today is, how has student mental health changed from last year to this year? And what issues are you seeing now that the school year has begun?
So something I think I've been seeing are, and y'all kind of touched on this too a little in the training beforehand, but parents, caregivers, guardians, a lot of them may have lost their jobs. And so obviously that's added financial stress at home, and kids feel that. They can come to school with that. And so, you know, I'm sure in times that was happening before all of this too, but definitely more so.
Oh no.
Okay, yeah, it looks like you froze a little bit, Kiki.
Are we good now?
We can hear you.
Okay. So school also looks very different than it did before. It can feel very different. You know, kids are farther apart from each other. There may not be as many extracurricular activities as there were before. That social aspect may not be the same. It may not feel the same. And that can be scary. Change is scary for everybody, I think. And so I've just kind of noticed a big part of that as well. And then also too, like if a student has to isolate due to COVID, or maybe they didn't necessarily have COVID, but they had to quarantine because of exposure, I'm seeing a lot of kids coming back from that, and they're just being kind of that extra social isolation, because some kids are kind of questioning, like, well, are they actually okay? Is anything else going on? So that's kind of an added self-esteem piece to that, I guess, as students are coming back from that. So that's definitely been difficult, just kind of this stigma associated with either having COVID or having to quarantine because of COVID exposure or something like that.
Thank you.
Something that I've noticed for a lot of students is the instability that I think they're feeling. Our area still has a lot of schools who are either fully virtual, some of them are staggered, and some of them are completely back with 100%. And we've got school systems that it seems like the board is meeting every other week or every 2 or 3 weeks, and there's this constant waiting to see what's going to happen next. And so on top of trying to figure out how to attend classes and do work virtually, or the new expectations, there's this inability to really know what's coming next. And I think that goes for students and teachers and faculty as well, is this feeling of, as soon as we start to know what's expected and we get our feet underneath us in terms of how to handle the current circumstances, suddenly now we have a new plan that we have to adapt to, and that frequent change, I think, is overwhelming a lot of students, or maybe just this inability to make a plan and know what's coming next, I think really overwhelms a lot of them. And they can feel that from the teachers as well. I think a lot of people here would agree that kids are pretty resilient, sometimes maybe more than we give them credit for. But they feel very much the stress and all of the chaos that maybe is going on around them in this school as well.
Great, thank you.
We have a very unique perspective in our program through Mental Health 101 because we work with so many different schools, so we get a nice barometer of what's happening in the East Grand Division. And so across the board, I think the thing we're seeing that's most different from last year is more loneliness and isolation, just reporting those feelings in general. And school is such an important part of students' social life, so that's definitely concerning. And another thing that's started to pop up is obviously in any given school year, there's going to be students that are continuing to struggle with mental health issues and begin to struggle with mental health issues. And I think this year, as opposed to other years, just from the word on the street, is I've gotten the impression that teachers feel a lot less equipped to handle those students. And not only that is there's just so much chaos, like you were talking about, Nicole. It seems like it's almost like the last thing on their list to handle. And not only that, some schools, they've focused so acutely on what to handle academically, and they're figuring out the mental health component as the school year starts, but that doesn't do a lot of good to students who are in acute suicidal crisis or in that acute other sort of crisis, and teachers don't know what to do. The counselor may be, not even in the building, and the teachers may not know who to talk to, and not even that, sort of beyond the school. When you're trying to think of making referrals to services, where do you even send those kids? Who's taking their insurance, who's actually open for services? Do they have the availability? Is the family set up to meet with the provider virtually? I think just a lot of those questions have been left a lot more open-ended, and it's leaving a gap to fill that I think teachers they're trying to figure it out because they want to help their kids, but they only have a certain amount of time in any given day. And it's unfortunate because schools are liable for a lot of those things that they're noticing. And I think kids are definitely slipping through the cracks.
Great. And Lisa, do you have anything for that first question?
Yeah, I think everybody just about covered everything really well. Caitlin's last point on the focus on academics is an unfortunate thing, and we're seeing that in our school as well. It's almost like a race to catch up instead of taking a pause and seeing like what's going on with our kids. So that has been very troubling. They've got everybody tied up this year doing a multitude of things, which has left really no one available to look to the students' needs, the kids' needs. And I'm seeing a lot of, as Caitlin mentioned, a lot of fallout from that. The only other thing I've noticed in terms of differences that's been a real trigger this year that I guess we should have expected is in a school system, especially if you're in a school, those transition years are tough. So for me, in a middle school setting, my rising sixth graders coming out of, intermediate elementary school, coming into middle school to see what middle school looks like, we don't look anything like, we used to. And they're already nervous. They're, new teachers, new standards, just scared, basically. They haven't connected to anyone. And again, everybody is so tied up. It's not giving us that opportunity to connect like we'd like to. And in addition, my 8th graders that went to high school, you know, we staggered in. So all this unpredictability of some all virtual, a few coming one day a week, some, you know, we have a lot of different types of things going on, as many do, but I think we almost have too many options. So there's no regularity of any sort. But my 9th graders now have not connected to anyone. So they're frantically calling and emailing and, can I come to before school? Can I come after school? Can you at least come by my ball game? I mean, they have no one yet. And so, you know, we don't have those clubs, those after school things where we really connect. There is some sports going on, but just not a lot of time with kids where we can connect, make relationships, talk, they can trust, you know, we can really help them. It's just been a weird year, and it's unfortunate that that's not our focus.
Okay, great. Thank you very much. So the next question we want to ask is, what can someone do when they notice that a student is struggling with their mental health?
I think listening to the student, one, is very important, just to kind of get a feel of exactly what's going on. Finding a way to kind of check in on that student pretty regularly, just to kind of see where their headspace is at. Things can change every single day, and they can also change throughout the day. So I think that's really important. Letting the school counselor know, or the school social worker know, if you are not that person, just so they can kind of keep tabs on the student as well. Letting the parent or the caregiver know too, just in case they aren't aware of what it is that's going on, so they can be on the lookout for some things to just offer support, referrals, if the student is already receiving some type of mental health service. Being able to kind of collaborate with whoever that is really important, just to kind of make sure everyone's on the same page, especially if the mental health professional is not in the school. We have some programs where they are, and that's very helpful. But if they are not, they're not seeing the student every day. They're not, you know, able to lay eyes on them every day. They come to their office, and a lot of things happen at school. Kids bring a lot of things to school. So that collaboration can be extremely important in kind of, you know, identifying those things and offering that support, and that kind of a thing.
Right.
And to add to what Kiki said, I don't know, I look like I'm frozen. Am I frozen? Or can you hear me?
We can hear you, Lisa. Yeah, your video comes on and off, but you're good.
Okay, cool. I think one of the things right now, since it is so, we're not able to support like we have in the past. Teachers, of course, have a big role, and they always have, and kids look to them. And I know a lot of our teachers are trying to slow things down as much as they can, to spend some time with those kids. So there's a lot of, you know, more community time. Teachers are checking in with kids, you know, on a more personal level as much as they can. I know I've done a lot of connecting kids to teachers. I brought a young man to the librarian because he loves to read and loves to write, and he wants to be in the book club when it can open up again. So I just wanted him to have he needed more adults to have, be involved with, and to have eyes on him, and to be a part of all the things he's going through. So just continuing to make connections with each other, using every person in the building for those kind of relationships. Our SRO has helped me with a lot of kids, bonded with a lot of children, and even our cafeteria workers. I mean, we should always utilize everybody, but more so now than ever.
I would definitely agree with that comment about connecting each other and students. I think something like you said that would be helpful all the time, but maybe now more than ever, is trying to find ways for teachers to build in some of that social emotional into their classes. And I know that is may feel like it can be a lot because teachers are already juggling so much, but it can be small things like when you do your daily check-in or attendance, especially if it's online, including a question about like, where's your mood today on a thumbs up or thumbs down or a scale of 1 to 5. If you've got students in the classroom, especially given now when there may be limited movement in their day, they may be staying in classrooms more than usual. So including little breaks where maybe they get to turn around and talk to the person behind them since they can't really group up like they normally do. Maybe you put on like a relaxing 2-minute video of ocean waves or something along those lines that are small, build in a break for you, a break for your students, but a chance to take a deep breath during the day so that, you know, everybody is not running around feeling completely overwhelmed and out of control. And I know that it can feel like a big ask. It can feel like, how am I supposed to add these things when I'm already trying to figure out all these other things? But that's why, you know, that whole keep it simple idea really does apply. There are ways to check in with students that doesn't have to be a big elaborate plan. And that way you can recognize, hey, this student usually has a thumbs up and now it's a thumbs down, or man, I haven't even heard from this student in a week, where I wonder where they are or what's going on. And that way you have a little more of information to kind of pass along to those other people. Because I think that's something I'm hearing is we want to be able to make connections with these students and help them out. But if they're not in front of you, how do you know which ones need help? And that can be kind of an easy way to build little things into your day that can kind of reach out, connect, and start showing the students that they have options and that this isn't just about making sure we learn the math skill or whatever class we're looking at.
I completely agree. I think there are little ways that social emotional learning and mental health can be incorporated into every single day, including, you know, there are bigger things you can do too. There are school-wide projects. You can make it this whole big thing, but it doesn't have to be. You can invite our program, Mental Health 101, into your schools. I know we've been working with Lisa for quite a long time. We work with Knox County schools and schools all over the East Grand region, and that's something they can do. But one other thing I sort of wanted to touch on, I think it's just so important, and thank you, Kate, for bringing this up in the chat. I think it's so important when teachers are having these conversations with students, they're going to them and being, you know, like, hey, I've noticed you've not seemed like yourself. I'm just, you know, I'm here for you. That they come at it from a mentally healthy space themselves. You know, there's that saying, you can't pour from an empty cup. And I think it really, really applies this year. Teachers are so burnt out. And, you know, some teachers do have sort of preconceived notions or their own personal feelings about mental health issues. And so I think it's important to enter into those conversations without any judgment and making sure you're not burnt out so you can, like Kiki was saying, like really, really listen. Don't, and not be just thinking about your next period or things that are going on at home, because obviously teachers are people too. They've got complications that not only arrive from the school day, but from things at home. And they've got all of this swirling around in their mind in this chaotic space that is the school year. So Kate, she said in the chat to put on their oxygen masks so they can better help our students. And I think that is just the perfect analogy. You've got to take care of yourself before you can even start thinking about your students. Because if you try to help your students from that frazzled space, it probably won't go as well as if it would have had you come at it from a very, from as calm a space as possible.
Okay, great. Now, I want to talk about our virtual students. I would really like to know what can be done to intervene and support student mental health when you're only working with them virtually.
I think that's a very, very good question. And honestly, I think the same thing can be done when kids are virtually. It just may look a little bit different, if that makes sense. So more than likely, the students may show very similar signs, even if they are a virtual student. It may be a little bit harder to pick up on because you're not physically seeing them all the time. But, during the time where, because I know virtually, there's times where students kind of work on their own, and then there's times where they can actually see the teacher and the teacher can see them. And so during the times where the teacher is able to see them virtually on the computer, I think it's important for those check-ins to happen. And it can really be as simple as like, how are y'all feeling today? How are you doing today? And some kids may not feel comfortable responding to that, of course. But you can see their facial expressions when you ask that question. You can see if they have any kind of change in behavior at all when you ask that question, even if you're not physically seeing them. They may start not turning work in. They may have a few days where they don't log in at all, and that may be kind of out of the ordinary for them. So that can be a sign potentially that something is going on and they may need a little extra attention. A phone call to the parent, of course, can happen if that's the case. So just like basically keeping that communication open, even if the student is virtual, offering that support still in a virtual way, offering those referrals, that kind of a thing.
Great.
I second what Kiki said, just paying attention to their body language, but I would also add in sort of paying attention to their surroundings as well. Like if they normally join you from their patio and they've moved inside, maybe that's not a concern because the weather is shifting, but maybe they're in a different room, maybe they're wearing different clothing. I've heard reports of students, they'll do the sort of the hoodie thing and they'll close it so you only get this much space. It's not the biggest deal in the world if they do it for one day, but maybe it becomes a consistent thing for them, especially paying attention to those changes, because of course clothing choices in themselves aren't the world's biggest indicator, but if they used to be one way and now they're dressing another way, and paying attention again just to their general surroundings. And I, like many others, have heard reports and news reports from around the country of things happening in those Zoom or those Microsoft Team backgrounds that have been concerning for students. So paying attention to those is really key, and I think it's definitely a different look than you get from within the classroom because you get to see their environment. Some ways it might it's more difficult to notice, but in other ways it may be easier to notice if something's going on when you're able to see their environment that they're in outside of the school.
Great. Nicole or Lisa, do you have anything?
The only thing I can add to that, Kiki and Caitlin covered so well, is sometimes when I did counseling online with kids through COVID back in April and May, sometimes, of course, it depends on how much privacy they had at home. Some parents would give them a room, they would shut the door and encourage them to talk. That's the best scenario, but not always what happens. So for a lot of kids, it became more emails, and everybody is emailing a lot more. Our student body is really emailing this year due to all this. They're getting comfortable with that, and it just goes well with our Google Classroom. So I feel like they've been more open almost through their emails and writing and things like that. We've done some open assignments with them that just lets them express, and that has been very helpful. Just to express how they're feeling, or with a great prompt that lets them open up. But it's been I'm not going to lie, it's not easy. It is the most difficult thing I've ever seen, is trying to support a kid virtually. You've really got to try. You've really got to work at it.
I think the one thing that I would add is I've heard from several teachers and counselors that there's a lot of students who aren't even turning on their cameras, whether that be in a classroom or even I've had students on a one-on-one meeting that don't have their camera on. So it's really hard to kind of get a sense of where they are. So I think something that some of the teachers I've known have done is made sure that on their Google Classroom or whatever, Canvas or whatever platform they're using, they have something where they're listing resources. So whether that be community ones, contact information for the school counselors, something like that, because especially like Lisa was mentioning, those students who have transitioned, maybe they're in a different school and they have no idea who the school counselor is. So they couldn't email that person if they wanted to. Setting up ways that maybe one of the school counselors, or if there's a therapist in your school or something like that, can just jump onto a virtual class and say hi for 5 minutes and just introduce themselves. That way the student knows they have options, because I think one thing I'm seeing is they're learning how to use these, like 10-year-olds have never emailed people before, so they're trying to figure out how to do that. So making that information readily available to them can make a big difference, because I mean, we've seen back in the, in the before times that students had a hard time going to find the school counselor in person, and that was when all they had to do was walk down the hall. So making that information right in front of them and reminding them of it every once in a while, so that they know what options they have and who they can go to if they do need something.
Great. Now I want to touch on another topic before we have, I want to make sure we have enough time. How can you be a good, trusted adult when a young person chooses to disclose their mental or emotional struggles with you?
I think I kind of touched on this earlier. Just don't be judgmental. I think there are a lot of students out there that view their teachers as almost like punitive forces. And especially, I think when students struggle with particular mental health issues and particular anxiety, like that conversation, they're already imagining it in their head to go very poorly. So it's okay to tell students, hey, this is a lot for me right now. I want to make sure I handle it right. Can I talk to you about it later when I've got more time? Because I'm feeling overwhelmed. They'll appreciate that a lot more than you rushing the conversation, because they'll feel dismissed, they'll feel shut down, and then all of a sudden you're not a trusted person anymore, because they'll be interpreting your behavior a certain way when you don't mean it that way. So being non-judgmental and just being transparent about where you are, so that you can handle it the right way when it does happen.
I'm going to jump off of, sorry.
Nope, go for it.
I'm going to jump off of that one and say, I think I've noticed myself, my motto lately when I talk to people is grace, grace, and more grace. Grace for yourself, grace for your student, grace for your coworkers, everything. So not only are we going through this tremendous amount of stress, but we saw mental health issues before COVID, right? And so I think now we're a little more aware maybe that it's going on, because we're recognizing the stress. And so allowing ourselves a little bit of understanding, giving our students some understanding, and maybe kind of using that in your mindset before you even have something arise. So I know I've worked with a lot of people in the past where once they kind of knew what that student was struggling with, there was more understanding, there was more wiggle room, they were willing to kind of work with them better. But maybe we put that on the front end. So maybe that level of support and space for the student is given ahead of time, so that it's not just because you finally heard what they were struggling with. If we just assume everybody is needing a little extra right now, then I think that can go a long ways. You know, I understand that you're in a classroom with who knows how many students, and they maybe have been cooped up all day and everybody's in masks, and it might be a really kind of difficult environment. But just kind of looking at it and remembering, like, hey, we're all struggling right now. What would I need? Maybe that would be helpful for them, and given a little bit of slack, because we can't expect perfection, or we can't expect pre-COVID levels of performance with what we're doing right now.
Great. Thank you, guys. So one of the last questions I'll have time for, I think, is what can someone do to support student mental health before a crisis? And this is going to be someone in any role. So whether that be the support staffs, teachers, administration, etc.
So something I think I've said a lot today is listen. Listening, I think, is just so important for everything. If kids don't feel heard or listened to, that relationship's not going to be there. If that relationship isn't there, then we aren't going to be able to support them in that. And so I think that's kind of my number one thing. And then, also too, just making sure other people are aware of what is going on, not just yourself. They obviously have different classes, they have different teachers, they may be bringing those things to each class, and so just kind of making sure that everyone is on the same page with all of that is important as well. Collaboration with the parents, again, if that's possible, that kind of a thing.
I want to just second what Kiki said on the listening. I think that's the key thing right there. And all of us can relate. If you're a child, have a parent, or if you have your own children, it's typical for parents to want to fix everything. And I know I did it with my own boys. We love them, our children, so much. We tend to not listen as well. And we're trying to think about how we can fix it, how we can help them. So I think for, the key thing is listen. Just listen and validate and restate and, develop that relationship, because they really just want to be heard. They most of the problems, or some of them, can't be fixed. They just need an empathetic heart and someone to take an interest and just be there for them and help them through by just their presence, really.
And I think that maybe that goes back to that oxygen mask as well. Just a reminder, if you're not in the space to do that, or you're not a comfortable person, or comfortable with being that person in the moment, you can tell the student that, they may kind of have a reaction to it, be braced for that. There may be a reaction of like, oh no, I've said too much. But it's much better to be upfront and tell a student, hey, I can sense that this is going to be a lot of information, or it's going to be a very heavy topic, and I'm not sure that I'm the right one. So let's go find the person that is. If they're in front of you, take them to that person, because it's much more beneficial to be able to tell them, I want to make sure you get the support that you're needing, rather than kind of half listening and internally freaking out because you don't know what to say to them. So remember to monitor yourself as you're dealing with that, because I mean, we've said it several times, we're all dealing with a lot. And so the ability to model that for students and recognize what your limits are and what you think is appropriate and the best way to help them is going to be very impactful as well.
Okay, great. Any last thoughts, Caitlin or anyone else?
I just second what they all said, and I think there was a great question in the Q&A and how to listen, and we'll be sending out resources, and we can, if we even have a couple minutes at the end, we can all chime in on active listening skills. But just quickly, I think it's important to just be present. I think that's the number one thing with listening, is just making sure you're actually there, not thinking about what the student may be, saying to you, or the action steps you need to take, thinking, oh, I guess I've got to report this to DCS. I need to talk to the counselor. Don't be thinking about all those things right then. Thinking about what that student is saying to you in that moment. And of course, it goes beyond just that. And we'll send information out about that as well. But again, I think just incorporating little things into your day, just little check-ins. I think that's probably one of the best ways to support your students before a crisis, just letting them know and building an environment where mental health is okay to talk about. You can, even as you feel appropriate, self-disclose a little. I think a lot of students, and when I was a kid, I viewed adults sort of as these all-knowing, all-powerful, not vulnerable, like they know their stuff, people. And so I think a little vulnerability is kind of welcomed when you're a kid, just realizing things aren't perfect. Because that's the thing when you're struggling with your mental health, is you just feel so alone. And it's really helpful to know that, other people have dealt with this too, and they've gotten through it, that maybe I can. Anything you can do just to bring a glimmer of hope to this situation, I think is just so helpful.
Okay, great. So we did have a couple of questions that we do have time to cover. So the first one was from David. He asked, do you see a difference in the feelings of isolation coming back from COVID between elementary students versus middle and high school students? Do you guys have any thoughts?
Can you repeat that one more time? I'm sorry.
Absolutely, Lisa. It's, do you see a difference in the feeling of isolation coming back from COVID between elementary students versus middle and high school students?
That's a great question. I'm still pondering it. I hope everyone else is as well. I've agreed, the resilience of kids is amazing, and they're so happy to be together, even if it's limited and in a different way. And I haven't been in the high school, so I can't really give a great answer on that, but I can say that a lot of students that I worked with through the years, even I even have some juniors and seniors calling me, they're struggling, and I'm not really sure if I'm not really sure if there's a difference maybe this year. I feel like there is a difference. I feel like I can say with certainty there's some sort of a difference in the way high schoolers are doing with this situation as compared to middle school. Middle schoolers seem to be, well, they're having their struggles as well, but again, just so glad to be together. I think high school kids are really feeling a difference, and all their activities, their social time in and out of school, there's something different. I can't quite pinpoint it. I guess we can make assumptions, but definitely I'm seeing a difference there.
Okay, great. Thank you, Lisa. So I do have a couple more questions in the box, but I want to make sure we have enough time to share resources and close out. So please feel free to drop those questions. I'm keeping a list of them, and we're going to email you all the answers that you need. But I do want to go ahead and turn it back over to Emily.
All right, thank you. So I'm going to go through just a few resources that are available for you all to access once this presentation is over. So we have a few helpful websites, and for the sake of time, I'm not going to go in depth into these. I'm just going to send those out in an email afterwards and give you guys a little bit of a description on what is helpful for each of these websites. I do want to spend some time talking about our additional resources we have listed here. The first one is our website, the Mental Health Association of East Tennessee. And on our website, we have free screenings. So I referenced some of those screenings when I was talking about the statistics with loneliness. And so anyone who is interested in learning more about maybe their risk for a certain mental health condition can go on there and take a free screening. And we also have a call center available. And the call center, the peer recovery call specialist will answer. And if you're an adult, you can call in and actually get advice for how to best support a student or a youth in your life and what you can do to be the best trusted adult for them. And another thing we offer is Mental Health 101, which is actually a free program that goes into schools. We do middle and high school age students, and we pretty much just take over a teacher's class for the day. And we usually partner with wellness teachers, and we cover the mental, emotional, and social health standards set by the state of Tennessee. And we do this through a presentation that is interactive. So we have students do small group discussions, participate in activities, watch videos, and try to have them open up about their own experience with mental health. And we teach them how they can best support their own mental health and how they can best support their friends and their lives that might be struggling. I also have the Helen Ross McNabb Center listed here and Frontier Health, and those are both two organizations that two of our panelists work for, and they both have mobile crisis numbers that you can call for yourself or for someone you may be concerned about. And then the last thing I think is most notable on this slide is the Tennessee Crisis Line actually has a text line. So when we think of youth, a lot of times they might not be as willing to call and talk to somebody on the phone. But this text service is available for anyone who might be struggling. And they specifically have people dedicated to talking about COVID and the additional anxieties and stress that somebody might be under from COVID. So if you have the opportunity to post this in your classroom or anywhere that you might come in contact with youth, I would really encourage you to do so. And so that is just 741-741. And all they have to do is text TN to that number, and they'll be connected with somebody who will text back and forth with them and offer them support. And then lastly is the National Suicide Prevention Lifeline, that if anyone in crisis can call, and then there's also a website that they can go to. I do want to take a moment to let you all know that we do have another webinar planned, and this is going to be on October 29th at 10 a.m., and it's going to be talking about prioritizing teacher mental health, how to survive and thrive this school year. So a lot of our discussion today did touch on how teachers are also under additional stress and might also be struggling with their own mental health. And if you're on the line, we invite you to join this webinar. We'll be sending out a registration link to that later on. But finally, with the last couple of minutes, I just wanted to give you all our contact information. So like we said, if you have additional questions, put those in the chat and we will answer those via email afterwards. If you want to email us after this, you can email us and ask an additional question directly. And specifically for the Mental Health Association of East Tennessee, you can email us at info@mhaet.com, and we would be happy to get back with you and answer any questions or connect you with resources that you might need. But I want to take a moment to just say thank you so much for attending our webinar today. We hope that this information was helpful for you, and we really appreciate you attending. And we will be sending out the recording. We're going to upload this recorded webinar to our YouTube page. And then the only other thing I have is that we have a survey to try to get your all's input on how you think this webinar went, what could be improved, or what you think was most helpful. And we are putting that in our chat. So Caitlin just posted that in the chat. So you can go to that link and please just take a few minutes to fill out that survey, and we will also be emailing it to you all. But thank you so much. I hope you have a good rest of your week. And thank you also to our panelists so much for joining. We really appreciate your expertise.